All right. Well, today it's an honor to be here with Mia Jones with the Agape Family Talks. Mia, how are you today?
Doing well.
Good, good. Mia, you are the CEO of Agape Family Health. Um, can you tell me a little bit about how you ended up being there and a little bit about Agape as a health center serving the community of Jacksonville?
Absolutely. I ended up here as my journey would start working in government. Started off in affirmative action, minority business programs, and then I went on to run for office. I ran for the city council here in Jacksonville and served on the city council for 5 years. After being reelected to the council, I resigned to run for the Florida House and won that race and ended up serving in the Florida House for 8 years. Was Speaker Pro Tem for 4 of those years and had the opportunity to really find a love and a passion for healthcare, which then brought me to where I am now, being the CEO for Agape Family Health, which is a federally qualified health center here in Jacksonville, providing healthcare services for insured and uninsured patients.
Okay, okay, great. That's great. And you guys have a new program called Mama Thrives. Can you tell me what that program is about?
Absolutely. The Florida legislature funded a pilot program which would allow for a program to be in Duval County and Orange County, allowing us to see if the use of technology would have a positive impact on the mortality of minority women as they go through the journey of getting pregnant, giving birth, and after.
Okay. So, and I mean, like, I, so I could see the big why here, right? You're dealing with mortality, but it sounds like this is something that you've been advocating for decades. Is there some other value or something that's driving the mission for this program that that has really inspired you and your team?
Absolutely. We decided to seek this opportunity because it was a competitive opportunity. We decided to go after this opportunity because many of our patients have found themselves in situations where they were not given the appropriate health care that was necessary to ensure that they would have positive outcomes through their pregnancy. And so, as a result of that, when the opportunity presented itself, this is a story that is not new to our country, unfortunately, and it's definitely not new to Florida. But as a result, the Florida legislature did decide to fund this pilot in an effort to see if some of the things that have been talked about, if they were actually implemented, what type of impact it would have. And so we're excited to be the tool to be used to see how things will go.
Wow, that's incredible. That the Florida legislature like actually did this. Um, I'm sure it took a lot of work and a lot of teamwork with some other health centers and interested parties. So, like, and what's the values that's driving this? As you guys are dealing with women, is there a particular group of women that you're dealing with, and what are some of the values that is really driving your service to these women?
Absolutely. For this particular pilot program, we are focusing on minority women, specifically African American and Indigenous, because the numbers tell us that those two populations in particular are more likely to end up in a situation where the mother will die either during childbirth or after childbirth. That being the case, we are focusing on that population, but we are serving the entire community as it relates to pregnant women within our community.
Okay. And I can see from your website as let me see here. Let's that you guys are, or your team is providing some of these services as far as labor and birth, postpartum and newborn care. Can you elaborate a little bit more on the actual services in detail, like that women can expect to receive through this program?
Absolutely. This particular program falls in line with the services that we were already rendering as it related to women who were either pre-child, pre-pregnancy, who recently got pregnant, and then those who gave birth, because we don't deliver. We have a partner who works with us, and they handle the deliveries at the hospitals. And as a result of that, we now have additional services that we are rendering where we are providing education for the moms, special education, hands on, where they can tap into information when they need it. So we will be providing tutorials and seminars and town halls and web podcasts that would allow us to share the information that they need based on where they are in their pregnancy. We will also use telehealth in order to help to regulate. We have a lot of women who end up with gestational diabetes, and so we want to help to regulate uh, their A1C and make sure that we can help guide them through the use of telehealth. They will all receive a blood pressure cup, a scale, and a glucometer, all to give us the opportunity to monitor them as they're going. One of the things we recognize is that there are certain times that the woman is told to come to the doctor, but then there are weeks that go by before they go back to the doctor. And so we will be monitoring them on a weekly basis for their weight, on a daily basis for their blood pressure. And if they have been diagnosed with diabetes, then we will track that on a daily basis. And when we see those spikes or those changes
Okay.
and they are trending in a negative,
Wow.
then we are going to help them by directing them to take action quickly. And we will either provide that service to them or they will go to their OBGYN that they previously selected prior to getting into our program.
Okay. So I know that this program is particularly focused on African American women and Indigenous women. I think I had heard that you guys are also possibly spreading this out to Latina women. Is that the case?
It is. We are, as a federally qualified health center, we provide services to anyone who enters our doors. We don't turn anybody away for their failure, their inability to pay, or because they're not insured. We take everybody. That being the case, some of our patients will be Hispanic patients or Latino patients. Some of our patients may be of other descents. That being the case, we wanted to have the opportunity to serve all with the services that we were rendering, and then being able to compare our population as opposed to just targeting the African American or Indigenous women. And so we are pleased that the Florida Department of Health agreed to that change and is allowing us to make sure that we're providing that service to everyone.
Yeah, but it does seem though, and I read an article in Bloomberg that really highlighted this fact that there seems to be, in particular, that women of color, as you alluded to earlier, are facing a crisis. And I mean, what is it? What's the issues that's stopping Black women, women of color, especially of Afro descent, from getting the type of care they need that we're able to minimize these mortality rates?
We believe that the impact that we are seeing, the negative impact that we're seeing, is coming from failure to listen, to put it simply. Um, Doctors are stretched thin. They are expected to see more and more patients. They are expected to spend less time with those patients. And so they find themselves in a situation where they are almost like a mouse on a wheel, just trying to keep everything going. And as a result, they don't always listen to each individual patient and what that patient is saying. Everyone is different, every pregnancy is different. That being the case, we need to make sure that our providers understand that as an African American woman, I may experience something during my pregnancy that a Caucasian woman doesn't experience. And if I come into the emergency room or if I come into the doctor's office and I tell you, this is what's happening to my body and I think something's wrong, I don't need you to brush it off. As my provider, I need you to listen to what I'm saying and then make sure that what you tell me to do um, will positively impact the negative uh, conditions or negative experiences that I'm having. And so we recognize that, again, healthcare is one of those things that it's about the numbers, it's about the money. And we have to slow things down enough and open our ears enough so that we can hear what the patient is saying and meet them where they are.
That's great. And tell me a little bit about your sponsors or co-sponsors. Who are they? How important are they to the success of this mission?
This program is being funded by the Florida legislature and the Florida Department of Health. Through those two organizations, we have been able to partner with the Florida Department of Health, Healthy Start um, of Northeast Florida, and others to be able to render services. And so we will, all of those two organizations have programs that they provide services to women who are pregnant. And so we will partner with them in order to make sure that we reach as many people as we possibly can. Again, this program has no financial requirements. So if you make $100,000 or if you make $10,000 a year, you can be a part of this program. We want to receive women from all communities and make sure that we are helping to provide value and making their pregnancy experience one that they will cherish for a very long time.
So if I am a pregnant patient and I need help and I need care, well, let me see here. I think there's some feedback coming in here.
Okay. So if I'm a pregnant patient and I need help, what are the steps to get the help, and what can I be guaranteed of as I'm part of this program for the duration of my pregnancy?
The steps would be we would first get you to sign a consent form that will lay out for you the program and who's a part of the program. Uh, After you have consented to be a part of the program, then we will make sure that we get the data that will make sure that we are providing you the service that you need based on where you are in your pregnancy. So we will get name, age, information that speaks to your pregnancy and where you are in your pregnancy. Following that, we will be asking questions that are what many would call social determinants of health. And those social determinants of health, although it may seem like a lot of questions are being asked, it's an effort to make sure that we're providing the services that are necessary to help that woman to be successful, to have a quality of life and a quality of pregnancy that we're looking for. And so we will help to identify from that mother if she's having issues with a place to stay, if she's having issues with transportation getting to her doctor's appointments, if she has not found a doctor yet.
Okay.
We one of our participants, when they came to us, they had not been to a doctor yet, and so we were their first point of access, and we took her by the hand. We made sure she got an appointment. We got her in. We made sure she got blood work. We got all the labs that she needed to get, and then we started identifying for that particular or each individual participant. We will identify what they need. So if they are living in a food desert, if they are unemployed at the time, if they are simply in a situation where they have a desire to learn more about natural childbirth, or they want to work with a doula, if they want almost anything. If they are a person that has chronic diseases, and as a result of those chronic diseases, we want to monitor those. We want to help to track where they are in that process and to help to ring the bell for them with their provider. If they are one of our patients, then we will make sure that their provider knows what's going on. If they're not our patient and just participating in the program, then we will give them the information that we have gathered for them to take it to their doctor. And so that when they walk into that doctor's office, they have information that will help that doctor to see exactly what's been going on. Oftentimes, when we go to the doctor, we just go in, we listen to what they say, and we leave. The doctor will ask, "Do you have any questions?" You might not have any questions at that moment. You might get home and have some questions, or you might have had some questions before you got there and you forgot them. So we're going to be educating the women on how do you have a positive doctor experience when you go into the doctor. What questions should you be asking in your first trimester? What questions should you be asking in that second or third trimester? If this happens, these are the questions you need to be asking, and making sure that you are taking control of your health, not allowing someone else to determine where you're going to ultimately end up. But we want the participant to be in the driver's seat and making sure that they're getting what they need.
Okay. Now, does this program, does it replace my doctor, or is it supplemental? You know, if I'm a pregnant, mom, is it supplemental to my doctor?
It's supplemental. It is definitely supplemental. We will make sure the women have internet access. If they don't have a smartphone or an iPad, we will provide that to them. When they talk to our service providers, it will be, it could be our pharmacist. We have a medication management program, or that's a therapeutic program to monitor the medications that the patient is on, to see how they are responding to that, and again, to provide information back to their provider. So as we are doing these things, if they need a dietitian, and the dietitian will sit down and go through, what are you eating? Okay. What do you have access to? If you have issues with getting fresh fruits and vegetables, then they may write them a prescription for them to participate in our mobile grocer program that will be a part of this, and our participants will have access to. They're there to listen. Our providers will be there to listen, to help, to guide, to provide information, to put the person in front of the service that they need in order to address their issues or concerns. If we have a situation, I know one of our clients already is in a domestic violence situation. So we immediately turn to making sure that she had access to the services that are here in our community and that are available to her, and helped her to navigate that process so that her quality of life can be better. And that's what we want. We just want them to have the best quality of life that they can.
And I know that some pregnant women and people in general, right? We tend to think if something is free, or since it's free, it must mean it's cheap and not worth my time. What do you say to right now a pregnant woman in the Jacksonville area, right? Duval County, and also some of the other counties you're going to be servicing for particular groups of people, and they can just reach out to you guys to find out if they qualify. But what do you say to a person who's thinking, hey, this is free, so it's cheap. Why even deal with Mama Thrive and work with the Agape family?
I would tell them that they should work with us because it's their tax dollars. Every single one of us in the state of Florida pays taxes, and this is an opportunity to access those tax dollars and to benefit from them, as opposed to simply just paying them out.
Okay, so what about the people who are thinking, okay, but it's not worth it? This program, is it going to really add value to me? And I know you've elaborated on some of the services, but again, is this going to be worth their time since it's free?
Absolutely. We want them to, I tell anyone, try it. And if you don't find value in it, we understand. Tell us what you would consider to have been valuable. This is a pilot again. I have to reiterate that. And so things will be changing. We might start one way, and this is a 1 year pilot. And by the end of the program, we may be doing things totally different because we will be listening to the participants. We recognize that for every person who participates, their situation is different. They will see things differently. They are experiencing things differently. And so it's going to be incumbent upon my team to make sure that as we're going through this process, that we ask the questions. Do they see a value in it? What type of value do they see in it? And that we get those testimonials so that other pregnant women can hear from somebody who's in their situation. And oftentimes we are more likely to listen to someone who's in our situation than we are in a program provider or an organization who's out there rendering service.
Okay. Last question. I'm pregnant. Not me. But I have financial problems. I have mental health problems. Or I have family problems. Can Agape Family and this Mama Thrive program help me?
Say that once again.
Sure. Just fix my audio here.
All right. So I'm pregnant. Can you hear me better? Testing.
Yes.
I'm pregnant, but I have financial issues. I have some mental health issues. I'm really depressed. I'm everywhere mentally, or I'm having some family problems, some problems with my boyfriend, with my husband. Um, can this program help me?
Absolutely. We will be able to direct or assist our participants in getting what they need, and it won't be everything coming from Agape. It could be one of our partner organizations. We have an advisory board that is made up of a number of representatives from various organizations, including behavioral and mental health services. And we will be able to get them the services that they need. And if we don't already have the connection for the service that they need, then we will be working on getting that and making sure that they're connected to what's available within our community.
Perfect. Well, thank you so much, Mia. This has been very helpful, I believe, to our Jacksonville community and women all across the globe who are going to be watching this broadcast. Any last parting words before we close this talk time?
I would simply say, especially to those in Jacksonville who find themselves pregnant over the next year, take the opportunity to see what Mama Thrive has available for you. This is an opportunity. It's a chance for you to be a part of making the difference in the lives of those who will come after you, but also in your life to ensure that you have what you need as you go through the journey of pregnancy and beyond.
Well, thank you so much, Mia. Thank you for those who've tuned into this, whether it's on social media or on the website. Please stay tuned because we're going to be doing this regularly. And this is just the first of many conversations with some of the providers, with legislators, with actual patients that have a story to tell, who are inspiring in and of themselves. And of course, we're going to hear more from Mia Jones as she talks a lot about what this program is doing, what Agape Family is doing, and how people can join this organization on their mission to touch people's lives. Thank you so much, Mia. And again, I'm looking forward to our next session.
Thank you so much for having me.